Hi, everybody. I'm here, but my camera will stay off because my internet is really wonky and I'd like to stay for the whole meeting.
Thank you, Bobby. It's so good to see you. Think we are waiting for Kurt still.
Good afternoon, everybody. I hope you're having a good afternoon. And this is PDPPC January Stakeholders Meeting. And correct me if I'm wrong, are we doing open forum or attendance first? Oh, thank you. Um, okay. First of all, if anybody is on the phone, please let us know so that we can add you to the attendance.
This is Cheryl Hargett Dorset. I'm here.
I think I heard Cheryl speak up.
You did. Yes. You did hear Cheryl Hargett Dorset. Yes.
Okay, is anybody else on the phone? I wrote you down, Cheryl.
Renee Farmer.
Okay.
Oh, hi, it's Tracy Heller here.
Okay. Anybody else?
Hi.
Okay. Do you want to introduce the poll, McKenna?
Yes, I will. So I'm McKenna. I'm a social work intern here with the participant directed programs. So I'm going to launch a poll for first time attendees. So if you have been to this meeting before, you do not need to complete it. This poll essentially just helps us collect your information and track attendance, and voting eligibility. So I'm going to go ahead and launch that. It should be open. And if you're joining online, you can find the poll at the bottom of your screen or under the More button, which has three dots on it. And if you're calling in, please unmute just like you just did. But if you didn't have a chance to, please unmute again, and Bobby will record your name.
Okay. Does anybody have any topics they would like to discuss during open forum or possibly for future meetings? Seeing no comments or hands or hearing no comments, I will say please reach out to us if you have any possible ideas for the future. Because that is really helpful because it is your meeting?
I did want to just provide a couple of small things to share with the group for open forum. I know that there's a lot of chatter going on right now about some of the LTSS sustainability actions that are going on. We are not going to be diving in depth into any of that work during today's meeting. And so I do want to encourage anybody who's interested in getting information about the LTSS sustainability actions to visit the LTSS sustainability webpage. It's where you can find the most up-to-date information about some of the upcoming changes that are going on as a result of executive orders. But yes, we will not be going into that in depth today. So I think Amanda will put the link in the chat. I'll read it off to anybody who's on the phone today in case you'd like to check out the website at a later point. So the website is https :// so hcpf.colorado.gov/Medicaid sustainability and LTSS. And so this is where you can find most up-to-date information about our sustainability actions that are going on right now. And then secondly, we haven't met for a while. And so I'm sure you've heard by now that we've had some changes to the nurse assessor process. And so we want to make sure that anybody who's interested can find out information about the nurse assessor and what's going on now. And so if you're interested in finding information about the nurse assessor, you can review Operational Memo 25-075 titled Ending Nurse Assessor. And I believe we also sent the memo out in the mail and in the email as one of the attachments for this meeting. So those are my two little open forums.
Any comments or questions to anything that's been brought up? If you have a question, you can also just speak up since I hear that people are having technology issues. Okay, I guess we'll just go forward.
All right, this one is mine. Hi, everyone. I'm Jessica Corral, and I'm the contract specialist for CDOS and IHSS. So I'll be sharing a little bit of information today about overtime changes as they relate specifically to CDOS. Next slide, McKenna. Thank you. Okay, so in Colorado, overtime regulations, which are set by the Colorado Department of Labor, say that live-in caregivers are eligible for overtime. As a reminder for those who might be unfamiliar with how overtime works, it is essentially that individuals earn 1.5 times their hourly rate of pay for any hours they work over 40 per week or hours over 12 in a day or shift. The CDOS regulations we have in place add an additional layer to this, and specifically for members on a waiver that serves CDOS and for caregivers who are relatives. So for relative attendants providing services to these members on waivers, they are not allowed to work over 40 hours per week. They are eligible for the 12 plus hours per day or shift of overtime. As many of you know, we've talked about it for quite some time now. CFC, Community First Choice, was implemented, and both CDOS and IHSS now sit under CFC. So since July of last year, new members enrolling into CDOS enrolled under CFC, and current members were transitioning to CFC at their continued stay reviews. So by this July, everybody on CDOS should be accessing it through Community First Choice. And I bring this up because that caregiver limit for relative attendance won't be applicable anymore. So what does this mean? On December 1st, it's important to point out that PPL and PALCO applied this overtime eligibility to all attendants, which means that nearly all attendants are earning overtime when they work it, and that CDOS employers really need to pay attention to the budget and to the hours that people are working, as to not overspend the budget and deplete those funds more quickly than you guys plan. We want to definitely make sure you guys are getting the services that you need, or your member is if you're an AR. Both PALCO and PPL provided a communication about this December 1st change in November. They sent it out based on people's communication preferences, so you either got it by mail or email, and it included some good information about what CDOS employers can do in light of this change. And I'll get into some of those details on the next slide. It's important to point out that, or if you didn't get it or you don't think you saw it, reach out to your FMS. I'm sure they'll be happy to send it to you again. It's important to point out that for individuals eligible for overtime prior to this December 1st date, those participants will be contacted, and there will be no effect on the member's CDOS budget for those hours. Next slide, please, McKenna. Okay. So as I mentioned, part of that communication the FMS sent out included really good things to keep in mind. The first is that, again, CDOS employers should really make sure they know when their attendants are working overtime, how much that overtime rate is, because it's different for everyone based on what their regular rate is, and keep a close eye on spending. Member PARs have never been revised for overtime and will continue to not be revised to account for paying for overtime. Consumer Direct, as many of you know, is a great place to get resources about all things CDOS and IHSS, self-direction in general. And so they are available to CDOS employers if you guys want to work through the member budget, get that updated in the member's attendance support management plan, or the ASMP. You can also redo CDOS orientation if you're interested in that. And then, of course, information and assistance has been available for a little while now, and that's a really good opportunity to work one-on-one with an INA coordinator at Consumer Direct to talk about things like recruiting more attendants, or how do you talk about overtime with your attendants, that kind of thing. It's important to point out that if you call into Consumer Direct and you want kind of on-the-spot help with budgeting or to update that ASMP, they're not able to do that, so they will schedule you for a coaching session. And then finally, important to point out that, of course, the FMSs are still available, always available to answer your specific questions about the services they oversee. And so reach out to their customer service if you have questions about your budget or how to access that information, either through the portal or the monthly member expenditure statement, MMES, or if you want to know more about how they're applying these regulations. Next slide, please. Okay, that's it. So that was a lot of information, perhaps, and so I'm happy to answer any questions, or we're happy to take some comments. I'll also look at the chat to see if any came in. And none did. But I do see Kurt is now here with us. So hi, Kurt. Welcome.
Hey, how you doing? How you doing? Sorry, everyone. I had a little connectivity and Zoom issues, but I'm here. And thank you, Jessica, for that presentation. Anyone have any feedback at all they want to
Kurt,
share?
I have a question.
Hey, Bobby.
Would you like to take over facilitating? You want me to continue?
If you could continue, that'd be great. I had a few other issues pop up, but since you're here, that'd be great.
Okay.
All right.
I do my best. but you're the
Uh,
historian in this team here.
all right. Well, I'll listen in. If I need to add anything in, I will be sure to do that. All right.
Do you see a question from Jerry? Um, they ask, will the PPL software indicate during data entry when OT has occurred? Uh, I think that means that when timesheets are entered into either portal or EVV, will it indicate that OT is happening? That's a really good question, and I'm going to invite PPL to answer it. We should have someone from PPL. Let me
Yep.
look at them.
I think I can take that one. So it does show up in the budget details within the authorization page of their portal. It does show that those are overtime hours being paid. I don't think it shows up specifically on a timesheet. It does show up on the providers, excuse me, on the attendance check stubs. It will show up as overtime. But where are we looking for it to be?
I hope that's helpful. Let us know, Jerry, if that's not helpful in answering your question. I see, Savannah, you rose your hand as well, so maybe you want to answer this on the PALCO side.
Yeah, I just figured maybe answering from the Palco side would also kind of help as well. Kind of along the same lines as what Julie said. So if someone is hitting those overtime restrictions for like the daily overtime or the weekly overtime, it's going to have a pop-up when approving the time saying that it does go over what is available. But as far as the overtime for the entire pay period that is allowed, it will not say that there. It's going to show on the check stub, though, kind of like Julie was saying.
Renee?
Go ahead, Renee.
Okay, on this overtime, can you please tell us what the deal is with the FLSA overtime exemption for live-ins?
Sure. So Renee's asking about FLSA, and that's Fair Labor Standards Act. That stands for Fair Labor Standards Act. And that essentially is the federal law that requires overtime for certain workers. And so under that law, live-in caregivers do not qualify for overtime. But as I mentioned, in Colorado, all live-in caregivers do qualify. So if you have live-in caregivers, Renee, then they do have that eligibility for overtime.
They do?
They do.
And where do we find that? Because we had that filled out, and it seems to no longer be effective.
Yeah, so that's a good question. I think like a lot of these kind of regulatory or policy related questions, it lives in a lot of places. So I'll start there. The information about overtime, both for Colorado and some details about FLSA, are in the CDOS manual. Consumer Direct has it in their coaching and orientation content. And I think there are a few other resources that Consumer Direct has. On the FMS side, it's also in their enrollment packets, as well as some of the resources they use to support their participants. So I would say, Renee, which is your FMS?
PPL, but maybe for all of us, maybe it'd be good if just for general details, if both PPL and PALCO could give us information on that.
Sure. Yeah, that's fair. Does PPL Palco, you want to come off and share how people can get more information for their particular questions about overtime? The best way for them to do that?
Sure. Well, Renee, what type of information are you looking for that hasn't been supplied?
The the so I guess first of all, am I understanding it correctly that the FLSA overtime exemption is still available for events?
No, it is
Or
not.
it is not.
It is not.
Okay.
The part of it where, I mean, it will still show that you have a live-in caregiver with you, but it does not exempt them from overtime in the state of Colorado.
Do you want to provide sorry to interrupt. Julie, do you want to provide the way Renee and others can reach out to customer service, kind of that information?
Yeah, I'm not sure what we have that I could send out right now. I'm going to have to kind of look on that. But we did send out an email to everybody explaining this, and I'll be happy to follow up and make sure that we have some information available online.
Because I didn't see anything in reference to FLSA.
Okay, great. We'll make sure that we get that out there if it's not online.
Okay.
Yep, and this is Savannah from Palco. Same for us. We did send out an email with this information, but if anybody is wanting additional information, the phone number to call for customer service for anybody that is calling, I'll also drop this into the chat, but the phone number is 1-866-710-0456. And I'll put that in the chat as well. And then the email is co-cdas@palcofirst.com.
Okay, and I have one more question. If we are showing too many overtime hours, what's the deal there?
Yeah, that's another good question, Renee. I think it's hard to answer though because it's really it depends on each individual's situation. So what I would say is if you or anyone is concerned about overtime hours happening and the impact that's potentially having on your budget, definitely reach out to Consumer Direct and they can take a look. They can have your budget with you and walk through how it's breaking down and if you need to make some decisions about how the hours are spread out or something like that. Do you know, let's see, can someone throw in Consumer Direct's contact information? Well, we get that in there. Is that helpful, Renee, or does that not really answer your question?
No, that doesn't. It's just in regards to the first December 1st through the 15th. After that seems to be correct, but from that first one, there seems to be too many hours there, overtime hours.
I see. Okay. Well, then in that case, I'm glad to hear it. It seems to have righted itself after that first payroll in December. I would say then reach out to your case manager just to let them know that this was overtime hours that relate to the change I just described, and that you should be back in line with spending for the rest of December and moving forward. I would not imagine, Renee, that would lead to kind of an overspending protocol episode or any of those kind of policy measures that we have in place for CDOS to help people stay in line with their budget.
I'll be happy to take a look at your account, Renee, after we get off this meeting and see if there's anything I can help with.
Okay, if you could give me a ring,
Sure.
or should I give you a ring?
I'll make sure that either I call you or one of the representatives do, but I'll make sure that we get the information first and then we'll call you.
Okay, great. Thank you.
You bet.
Any other questions out there? Hearing none, seeing none, I guess we'll move forward.
All right, thanks, Bobby. I think it's me still. I've got a
Okay,
couple here, so get comfortable, folks.
it is you still.
It is me still. And this one relates to family and medical leave insurance and a recent change that occurred this month. So if you would go to the next slide, McKenna. All right, so I would hope that most people are familiar with family, which is the acronym we use for family and medical leave insurance at this point. But if not, no worries. It's essentially a state benefit program that was recently put in place, providing most Colorado workers the opportunity to have paid time off for family and medical related needs. And this program is funded through employer and employee payroll premiums. Family is within the Department of Labor and Employment and a specific family division. So when workers need this time off, they submit their requests directly to the division. And I bring this up because it's slightly different with sick leave. Many of you on CDOS are familiar with requesting sick leave through the FMS. And that's often for more short-term needs, like you need a day off because you're sick or you have an appointment, that kind of thing. Starting the first of this month, the family premium did decrease. So this is good news. And it went from 0.90% to 0.88%. And so what this looks like in practice is that for employers with 10 or more employees, they and their employees pay half of the premium, so 0.44%. For employers with 9 or less employees, only their employee pays that half of the premium, the 0.44%. Go ahead and go to the next slide, McKenna. All right, so a lot of these helpful tips, things to keep in mind, apply specifically to CDOS, but I think it's good information for IHSS as well, the IHSS agencies we have on the call. For CDOS, the employer premium is built into your cost to you. So when you're doing your budget and you're trying to figure out if it applies to you, if you have 10 or more employees, that cost to you worksheet that the FMS provides you will be a great resource to look at. For the employees, you'll see that premium deduction on your pay stubs, each pay period. And then for a majority of CDOS employers, they don't have 10 or more employees. And so again, the important thing to keep in mind is to take a good look at the cost to you worksheet and just be aware of whether or not you as an employer are required to pay your portion of the premium. I think this goes across the board, just maintaining good communication with your attendants, with your workers, make sure that they understand that family is available to them, how to request it, and if they want the details about how much it's costing them, I hope now you can give them that. Another thing to keep in mind on a CDOS level is it's really important to follow your FMS's process to disassociate your employees if you fire them or if they quit. This is just good practice in general. If people are not working, it helps to make sure that your records are up to date. But you'll definitely want to reach out to your FMS if that is the case, and they can help you with that process. Another important thing is to definitely review your monthly expenditures, make sure you're on track with your budget, and that you, again, fully understand how the cost to you relates to how your budget is used for CDOS. And then I'll just share finally that, again, Consumer Direct has some really great resources. Your FMS continues to be a good resource. And so if you need some budgeting support, or you have any questions about family, reach out to Consumer Direct or your FMS, and they can answer some of those basic things or work with you as it relates specifically to CDOS. If you have questions about what kind of leave situations qualify, how to make requests, how you or your workers would get those payments, unfortunately, we can't answer that, and neither can the vendors. So it's really important to reach directly to the family division. And I've put their website and email on the screen. I think they do have a phone number, and I can find that in just a second. That I think is all I have for this one. I know we're a little ahead of schedule, so if there are questions or comments, I can definitely try to take them. All right, I'm not hearing any, so I'll just give you the phone number for the family division, and then I think we can move on, Bobby. So the phone number is
Okay.
1-866-263-2654. And I'll put that in the chat as well.
You're awesome, Jessica. Thank you.
Thanks, Bobby. All right, I think that's all for me today. Thanks, everyone.
Okay, next topic is difficulty of care and restarting FMS information, and it lists 3 presenters. So I leave it open to whoever wants to go first.
Thanks, Bobby. This is Danny with HICPUF, and I'll go ahead and kick us off here. Thanks for the introduction. So I'll be going over difficulty of care restart, and then the FMSs are going to share some information specific to their processes. So first and foremost, difficulty of care payments are restarting for CFC. The difficulty of care exclusion is a federal and state income, is when a federal and state income tax is excluded from taxable income. So we often call this difficulty of care payments or Medicaid waiver payments. When CDOS and IHSS was added to Community First Choice, and attendants were no longer providing services under a waiver, we had to pause difficulty of care payments or the income exclusion. HICPUF did request an IRS ruling to identify if difficulty of care applies to CFC services, and that was approved in December. And when I say we paused difficulty of care, I apologize by saying that was not a HICPUF we, that was a decision of how the taxes get excluded. So HICPUF requested the IRS to count CFC services for difficulty of care, and it was approved in December. So July to December income tax was withheld by the FMSs. PPL issued refunds on December 24th, and then PALCO will list all 2025 withholding W-2s for refunds directly from the IRS. We have some difficulty of care resources that we'd like to share. So all W-2s received by CDOS attendants are accurate. FMSs will not issue W-2Cs for difficulty of care. PPL, the difficulty of care amount located in box 12, and for PALCO, difficulty of care amount included in box 1. The IRS explains how taxpayers can account for difficulty of care payments when filing a return, whether wages reported in box 1 or box 12. In the slides that were provided today, there's a link to the IRS site where you can learn more about how to file with difficulty of care payments. We also have some links and resources for working with a tax professional. The Colorado Department of Revenue has community tax help. There's 211 Colorado, IRS Free File, and then we have a little bit more information in HCPF Informational Memo 26-001 that was issued on January 7th of 2026. And I think we have somebody that is going to be putting these links in the chat for anybody who would like them. And then I'm going to kick it over to PPL to speak a little bit about their process.
Hello, everybody. My name's Lynn, and I'm from Public Partnerships. Can everybody hear me? I just want to make sure my volume's on. Great. Thank you. Thank you for the head nod, Danny. Okay, so I did want to just let everybody know, first of all, that we do have this information available on our program webpage, and I'm going to go ahead and put that link in the chat here. I know it's in the document, but there you go. You can have it in the chat. So for attendants who are still difficulty of care eligible, we're asking that they submit an updated difficulty of care form to PPL by April 1st, 2026. And the reason for this is, sometimes people's difficulty of care status can change. And so we just want to make sure that since we have you on record as eligible, that you are still eligible. And so that's why we're asking for the additional form by April 1st. And if you do not submit a new, if members do not submit a new difficulty of care form and they are already eligible now for difficulty of care, then the difficulty of care status will be discontinued until we do receive that new form. If you have any questions about that, you can contact PPL at the address and the phone number that's shown on the slide. And earlier in the meeting, I had also posted it in the chat. Does anybody have any questions? I'll take that as a no.
Wait,
Hi, Bobby.
I have one.
Okay.
What specifically makes an individual qualified for difficulty of care?
That's a very good question. So the person has to be living in the home that they're within, where they're providing the services. Hold on a second. I want to make sure I talk to this exactly. Hold on a second here. There's 3 points of criteria that somebody needs to meet. A second here. I'm getting there.
No problem. We're patient.
Oh, that's great. I love that. I want to just quote the exact questions. Hold on. Let's see here. So their three questions are, oh, doggone it, it's not on here. I'll get back to you that and I'll post it in the chat. I apologize. I don't want to
Okay.
waste any more time on the meeting.
Okay. Whoever is doing slides for me. Yep. And then the next person, please go.
Hi, yeah, I think there was one more hand up. I don't want to jump ahead. I believe it was Robin with her hand up.
Can you hear me?
Yep.
Okay, hey guys. In relation to the DOC, and please pardon my ignorance on most of this, on the unemployment taxes side, can you give me just a brief overcap of that? It's not reported or commingled within the unemployment piece. Am I understanding that correctly?
I'm sorry, Robin, can you rephrase your question? Say it again,
What
please.
what I'm trying to understand is the DOC is not applicable to unemployment taxes that's withheld. Do I understand that right? Is that what that's saying?
Yeah,
I do not.
I can take that. Yeah,
Okay, no,
it's only applicable to your federal wages, to the wages earned.
Okay, thanks, Julie. The reason for that odd question is I've come across some issues in talking with the Unemployment Division of Labor where a CDAS care provider, and if the way always understood this program is that it is specific to the participant, right? That's the basis of CDAS is for the benefit of, like, say my son or any others with disability. This program is for them to keep them out of institutionalization and blah blah blah, right? So
Correct.
just a quick broad overview. um, there's a battle with Department of Labor in that where you have been a full-time employee, laid off, and should be a slam dunk eligible for unemployment. You are then penalized and denied benefits because you are employed as a CDAS employee, I guess, correct?
I've heard mention of that once or twice, but it always seems to have been resolved very quickly. I don't know that we have any outstanding issues on that.
How has it been resolved? Through
Uh,
CDAS
uh,
unemployment?
no, it was through unemployment.
Okay. And the reason I'll give you straight up, it's based on my employment, losing full-time priority, employment, but during that whole time, still acting in a caregiver position. The state is then denying based on availability. Um, and I've heard in talking with many of the heads at the Department of Labor that this has been an issue for other care providers. And I just want to kind of follow along so I'm able to assist down the line for all other Coloradoans who have encountered this issue, because they have also informed that there have been other instances of this. And of course, I'm not privy to information of resolved, unresolved. So I just
Sure.
thank you for that, Julie. It's very disconcerting. Get caregivers, and then they're penalized when they're trying to work multiple jobs, being
Right.
denied benefits or denied, or it's just chaos. It's crazy.
So the amount is still visible on the W-2, for instance, of what
Mm-hmm.
was paid, but box one is they're left out of box one on the W-2 because
Right,
that's the amount that is not federally taxable. But all those wages are still open to FICA and FUTA and
right,
SUTA taxes. So there should be a place on there demonstrating that you did make the money and that those taxes were paid on behalf of that, just not the federal income
right. But
tax.
Colorado's still basing it basically as a
Mm.
penalty if you are a CDAS um, employee, that you're still employed and you were denied benefits through another employer who should be slam dunk legal. So it's like they're using it as a legal loophole, so to speak. So I
Yeah,
don't know. I just think that's something to table for later for this program because it's really, really crazy.
yeah. If you should get more info on that, I'd be happy to take a look at it and get it over to our tax department, so that maybe they could, make a call and intervene just to see what's going on. But I'm really not aware of any active complaints at this time that we're working on about that.
Okay, well, I'm hassling them big time, and I keep appealing, and we keep meeting, and I keep winning all their appeals, but they're like, "Nope, sorry." I'm like,
Yeah,
"What are you talking
gosh.
about?" It's a legal loop, and they're really monkeying the system. So, for caregivers in general, this is a topic I think that should be followed up on, which I'm working on. So I'll keep you posted.
Sounds great. Thanks.
Hi,
Thanks,
Danny.
everyone.
I see you have your hand up.
Yeah, I was actually just going to try to jump in and get us redirected. I think that the issues that Robin was describing um, probably aren't directly related to difficulty of care eligibility, while they do sound like a related tax issue with the unemployment insurance. So I just wanted to say thanks, Robin, for sharing your experience, and we can look into ways to make sure that you have the information that you need to be able to um, make sure you're being treated fairly and correctly. And I think we can definitely connect offline about this, or you can connect with PPL directly if you want to go through a specific situation, and they can take a look at your pay stubs and what may or may not be getting pulled out for that. So thanks for that. And then I think, Robin, you were the last person that had a question for PPL. So I'm going to kick it over to Palco now, so that they can share information about their work.
Perfect. Thank you. I just wanted to jump in and kind of grab Bobby's question, since I had that information up. We do point people over to our payroll information worksheet at Palco anytime that they have questions about if their difficulty of care exempt or not. So I'm going to drop in the chat kind of what it says in our payroll information worksheet. It's just a little snip that says kind of like what it means to qualify. And then we have attendants claim for themselves, whether they're exempt or non-exempt. We don't advise one way or the other. So I am going to drop that down into the chat box just so that's available for you, Bobby. All right, so I will go ahead and get started from the Palco side. Along the same lines as PPL, we did a lot the same thing with difficulty of care. So restarting in January, just like PPL had stated. Attendants that were eligible for difficulty of care from that 7-1 transition over to CFC through December were moved back to difficulty of care. And so what we're needing from this point forward, just like Lynn had mentioned, is we're needing some documentation from those attendants saying that they still do believe that they qualify for difficulty of care. So we did send out an e-blast that included what we're calling an attestation form. That form's super simple to fill out, and it basically has a kind of like a yes, I do still feel that I qualify, or no, I do not feel that I qualify and there has been a change and I would like difficulty of care to be removed. So attendants will need to choose one or the other and send that back in to us. Same kind of concept as PPL stated, where if we do not receive that by April 1st, then we're going to assume that you are no longer difficulty of care exempt, since we did not hear that you do want to continue. So we will turn the difficulty of care exemption back off on the account. And then moving forward, we would need a new difficulty of care exemption form, so a payroll information worksheet, in order to get you exempt moving forward after that. And then if there are any questions, if you're needing a new copy of that form, you can always reach out to our customer service or to our Colorado client engagement team. So the phone number for that is the same one that I mentioned earlier, but it is 1-866-710-0456. And then the email box is co-cdas@palcofirst.com.
Does anybody have any questions?
I just wanted to note for a second that Tracy did put in the chat the 3 questions that qualify that determine whether or not somebody is eligible for difficulty of care. And like Savannah says, it's a self-reporting situation.
Yep. Seeing no hands, hearing no comments, I'm guessing there are no questions. Erin, would you like to take it away?
I would. Thank you, Bobby. Hi, everybody. It's Erin Thatcher from the department. If we could go to the next slide, we're going to do a quick overview of HMA documentation requirements. I want to give a little bit of background. We met with a work group in, I want to say like September or October of last year, and worked on some additional resources to support members in self-direction with getting documentation together. This isn't a new requirement. We're just restating that documentation is necessary for health maintenance activities, and case managers are required to get this information in order to complete their assessment and appropriately authorize health maintenance activities. So a policy memo was developed and published in early January. It's policy memo 26001 that talks more in depth about what documentation is required, why it's required, how it can be provided, and some additional details. But I'm going to go ahead and just do an overview of what's in the memo. Firstly, if you are a member self-directing, you are taking a more active role in your service delivery, or you might have an authorized representative or AR who's doing that for you. So it's your responsibility to gather documentation to support any need for skilled care. Now, when we say documentation, we're not asking for orders. We're not asking for signed affidavits or attestations from a physician. We're stating that we need medical information that helps substantiate the task that is being provided. And there's some new things related to the memo I will mention here really quickly. We put in a new requirement about recency, like how recent does the document need to be? And so if we're talking about a child in self-direction, things need to be within the last year. And then for adults, it can be dated within the last 3 years. We do have a couple of items to help. So the new documentation checklist was developed with people in the work group, and thank you all for your participation and guidance on this. We released this in December, and it's a member documentation checklist meant to help people self-directing figure out what documents could be helpful for each task. And then secondarily, we've had for a long, long time the HMA documentation guide, which is a case management resource that helps case managers effectively document someone's need for skilled care. And that's been updated several times. Again, people in this group and PDPPC and several work groups beginning back, I think in 2020, 2021, have worked on this. And it's a really important resource for our community. So those 2 things are available. We'll put the links in the chat. And I think the big picture here for everybody is if you are self-directing, it's your obligation to provide information so that we can get the right level of services approved. That said, we're not moving to a place where we need orders or doctor signatures, but we do need things to substantiate the care requested. So I realize that this is maybe new for some folks who might have some questions. I'm happy to take any right now. And I think Cindy, I see your hand raised. Go ahead.
Yeah, this is Cindy. This is actually an area I've been trying to get some help from case management and consumer direct, and I've not gotten much support. So, first of all, because I have low vision and I'm hard of hearing, you'll have a difficult time accessing the links you put in the chat. Can you send that stuff out to folks who are participating in this call?
Cindy, yes, we will absolutely send that out to this group.
Okay, that would be helpful because secondarily, I'm looking at having a knee surgery and I've been trying to figure out and ask folks, how do I document, the kinds of things that I need? And I really cannot get a straight answer. Will this stuff help with that?
So, great question. And first, I just want to say thank you for sharing your experience and frustration and trying to get the right answers. We will definitely look at that and see if there are things that we can do differently or better to help support you getting this information. So, both of the documents that are listed here, the documentation checklist and the guide, they have different purposes. So the checklist is, and I don't know if we can bring it up on the screen or not. That might mess up Zoom. Um, so, Danny's going to try here to get it up. So please, if you are challenged with scrolling like I am, we're going to bring up the HMA documentation checklist. And so this is a 3-page document, and it's meant for members or authorized representatives to guide what might be helpful. So in general, if you were to go to the doctor and say, can I have a copy of my history and physical or a copy of my chart, they should be able to provide that for you. And if you have access to your chart through Epic or My Chart or many of the different electronic medical record system, you should be able to print out or save your medical records, including medications, last visits, things like that. But essentially, we're looking to just validate that, yes, you have a skilled care need. And I'll give one example that I think is we ran into recently. We had a woman who was looking for oxygen. She needed respiratory care support, and so the case manager asked her, where do you get your oxygen? And she said, well, I got it from Safeway, like the little can. And the case manager is asking, well, do you have an order for oxygen? Do you get any delivered to your house? And she said, no, I just use it when I'm feeling out of breath. And so that's really the key here is we're saying if you had oxygen ordered by your doctor, it's going to be delivered to your house from Apria or another provider. We would just need to know that so the case manager could document it. And it's probably in your chart someplace. Some things might be a little bit more difficult to find. And one example I've got, which is a personal one, I've got a kiddo who has a Bell program, and the urologist gave us a visual, and I remember what it looks like. I could not for the life of me find the document, but the urologist office had it, and they're able to get it to me, and I could give it to the case manager so that we make sure we've got the right time approved on the care plan. So I hope those are a couple of things that might be helpful. I will say for you, if you'd like to look at the documentation guide and go through what the specific tasks are, it gives you some suggestions. And then secondarily, Consumer Direct, we've got some support there for information and assistance who we might be able to help you gather information or at least get you pointed in the right direction.
That would be helpful because I actually am in the process of doing my annual evaluation, and I'm not kidding. I know that it's supposed to be clear to everyone, but it's not.
I know. Cindy, I hear you. And I'll just say, have had to do this personally, and it's interesting what's missing, from different records. And so it is a little bit of a wild goose chase, I think, when we're first getting into it. But we're trying to help set people up for success. We're not trying to make it really burdensome. We're trying to say, if you have a need for HMA, let's demonstrate that with documentation so that you're getting the right level of care and level of support.
Sure. All right. Well, this checklist will be nice. Thank you.
Thank you, Cindy. And we'll be in touch. Okay, let's see. I'm not sure who's next, Joelle.
Yes, hello. Can you hear me okay?
Yep, go ahead.
Awesome. Thanks, Erin. Thanks for this overview. We do have this. I just wanted to confirm the documentation is needed for all categories, whether they're turning yellow or not.
Yes, so
Correct.
what Joanna is speaking about is the direct care services calculator, which is like the task worksheet kind of in in the olden days. So there's some functionality that changes colors for case managers, indicating they need to do something. And so the answer is if you have HMA, if you have a skilled care need, we need documentation to support everything. Now, that doesn't mean we need a different document for everything, if your history and physical from the physician has like your medications and your diagnoses and your DME, that might be everything we need. So it's important to kind of look at what you could get that would provide the most information. One thing I do want to point out too is like if you've got, let's say you're an adult and you've got a really, a 10-year-old Hoyer lift or a lift of some kind, please just share with your case manager you have a Hoyer lift. If we need to get a picture of it to validate that that exists, like be open to do that. We're not trying to, again, make it overly burdensome, but having information about like DME is going to be really helpful in making sure we've got the right categories.
Got it. Thank you. I guess a follow-up question to that. So if you're saying a picture of a gait trainer, like we have a family who uses a gait trainer, but the case manager wouldn't allow the time because there wasn't like a physician order, but mom had bought it out of pocket because she couldn't get Medicaid to cover, so they wouldn't allow us that time. So I guess thoughts on that or
Yeah, I would get a
recommendation?
picture. I'd say
Okay,
like,
so
do
a
you
picture
have,
would work.
because yeah, like I'm just guessing, but I'm pretty sure that there's a home exercise plan in the picture with how to use the gait trainer or how to use the standard, or when and like what kind of duration you're looking for. So I would kind of go that direction too to see if there's additional help from like the PT side of things.
Got it. And then this checklist, I know it says that it's going out to new members. Is there a timeline when case managers have to send it out for families for their CSRs just so they have time to gather the documentation?
Great question. I'm gonna have to phone a friend. Danny, I cannot recall at this moment. I know we're looking for, so if you've got let's say you're not on services yet, you need to be providing documentation prior to the start of care. We're gonna pull up the memo here real quick. Um, it's in here. Thank you, Danny. And so there is a timeline. We're going to get to that in just a minute here. But I would say this for members, again, self-directing, if you can work on getting information as you're meeting with your physicians, your medical team, I think that would be really helpful. Okay, so sorry. All right, Danny, I think we're here. So in our memo, we say for members with current HMA, we're going to continue your services through the CSR unless there's a change in service requested. We would, at the CSR or continued stay review assessment, we would ask for documentation and give members some time to get that together. If 30 days into the new certification, we don't have the right documentation, then something may not be approved. So as with anything else, if there's a denial or a reduction in services or a change in services because of this, the member or the family will get the notice of action, the long-term care notice of action to appeal.
Got it. Thank you.
Okay, thank you. Okay, I know we've got, just want to do a quick time check, team. Are we still good to take questions or where are we at?
It
I think we're
looks like you have two more questions.
Okay,
and I
I
think
see.
we're ahead of the ball, I
Okay.
believe. I think
Okay.
we're doing okay on time, I think.
Okay, great. All right. I think I see three hands raised, and I'm not sure who's first, but I'm going to go left to right on my screen. Daniel, go ahead.
Wonderful. Thank you, Aaron. So two questions, one that just came up, and the initial one, as far as the submission of this HMA documentation for IHSS agencies, is this collection of documentation directly from the client and then it goes to the case manager, or would the IHSS agency have some part in that as well? And then the second question being, if the client ends up going into that 30 days into their new plan and then they end up being found to not it's not they're not allowed to stay on it due to their medical condition. Is that 30 days still paid to the agency that was providing care during that time?
Great. Two questions. Thank you, Daniel. So, first question, it is the member's responsibility, member or family or authorized representative, to get documentation. The member and family could always ask the agency to help if they're really struggling or if they just need some support. In addition, we've got Consumer Direct who can help with information and assistance to potentially give support in getting information together. When it comes to service changes, we would continue services for the agency and then issue either a change of PAR within that or after that 30-day period. And it's likely that things would be personal care. So it's not that services would be totally denied, but we would be saying we don't have enough information to support like bathing being skilled. So we're going to approve personal care bathing. So all of that would be communicated with the agency at about the same time that the family and authorized representative is notified. Okay. Jamie, go ahead.
So question, will the case managers be responsible for getting any of the medical information? And are they still getting the physician medical information pages? Because I've seen cases come in with very few diagnoses, maybe one or two. So I'm just curious as to what's going on as far as what case managers are, what information they're getting.
Thank you, Jamie, for being here, and thanks for the question. So the PMIP or professional medical information page is only required at the start of services, like at initial enrollment. So we're not getting that annually anymore. And I will say we've seen some that are really complete and some that are not. And so the case management agencies are getting that information at the start of services, but the rest of the like supporting documentation should be provided by the member to the case manager. This is not an obligation of the case manager. Their job is really to collect and then review and then upload the information into our case management system.
Okay, thank you.
Thank you, Jamie. Okay, Maureen, go ahead.
Hi, my name is Maureen Welch. I work mainly with groups of families that are more on the intellectual developmental disability side, but now we have the new option of using CDOS. So I'm trying to get schooled up in this new option. So I appreciate being able to come and learn and listen. I had a couple questions. I have quite a few families who had a PAR for CNA, and they've recently been denied their PAR. And they've been told by their case manager that they can't do the care calculator for HMA until their annual CSR review, which I think because they're losing services, that should be lifted. I'm just wondering if there's any clarification. They are interested in exploring CDOS once they get the HMA, but there's sort of this backlog of, I think, protection around giving too much work to the case managers. They're trying not to get everyone through the care calculator at one time, which I respect, but we're having lagging of services and economic hardship on families. So I was just wondering if there's any person or resources within the department that we might be able to rely on for any advice.
Oh, thank you, Maureen. This is such a good question, and thank you for coming. We're so glad to have you. Welcome to the dark side of self-direction. No, we're actually the
well,
best.
Unfortunately, my son is on the DD waiver, so I can't use CDOS. I wish we could have CDOS in the DD waiver, but anyway, I'm learning it for the rest of the community.
I don't know. You might come over to the other side of things eventually, but anyway, so to back up, what Maureen is asking about is certified nurse aid or CNA services that are a state plan benefit, and those PARs or prior authorizations are getting turned back on. So some families are coming to the realization that like they may not qualify for CNA or registered nurse services like they had been receiving. And so those members really do have an option to get CFC or community first choice. So a couple of points I'm going to make. We haven't actually seen a lot of denials in CNA yet. I think we just looked at this morning, like 13 people so far. And most people the agencies have the ability to do reconsiderations and some other things. But let's just say the agency's not willing to continue to provide services without a PAR. PARs are going to be required May 1st. So there's like a little bit of time for agencies to continue providing services until the PARs are required. But if we say that, there's a family that won't be getting CNA or registered nurse anymore, we want to make sure they have the ability to get onto CFC. So I can work with our team here, our case management team, to see if there's any movement on that front to like get that care kind of expedited or those assessments expedited for folks who might be in danger of losing services. Or if an agency just says, nope, we're not going to do that anymore, then we have a problem. So I do think there's some flexibility right now with how the services can happen and be billed, but I do see where you're coming from and see where we could have we might need a little bit more clarification provided to families for what to ask for and how to kind of get the ball rolling.
Yeah,
So
and
we
maybe
will work
even
on
a
that.
contact person, Erin, at the department, because it seems to me like some of the home health agencies, I mean, they're all spinning. And then I think I also probably should have made a distinction in my question, is some of them are getting denied, but some of them are just getting drastic reductions from 6 hours a day to 1 hour a day. So that's not a full denial, but they're losing services. So would that trigger the ability to do an HMA analysis because they're losing so many services? Not necessarily a full denial, but a huge reduction.
Great clarification, and thank you. Okay, and I'm not in charge of case management, but I would say to me that sounds like a perfect situation to get like the assessment done, try to get services going for personal care, homemaker, potentially HMA through CFC. So
yeah, but they're saying you can't do that till you're CSR. See, that's the problem.
Well, question would be like, are these new waiver people? Because if they've never been on a waiver,
no, they've been on a waiver.
Okay. Yeah. Thank you. I will take this back. I will personally get in contact with you about what we can do.
And again, I'll stick my email in the chat for you.
Okay, perfect.
Thank you so much. I really appreciate it. Yeah, I have a feeling this is going to be escalating, so I kind of want to get ahead of the avalanche here.
Totally, and so do we. So thank you for bringing it up. I appreciate it. And let us know if there's other things that we can help with. Okay, let me look. Are there any other hands raised? Okay, thank you, Maureen. Okay, Bobby, I'm going to hand it back to you. Maybe. Bobby, are we here? If I think you're on mute. Okay,
Yeah,
there you are.
I need to see a slide so I know what I'm doing. Okay.
Hey there, I think we want to go past that chat review. Do we have anything in the chat that we need to talk about? I don't know if anything popped up in there.
Yeah, it's Amanda. I took a look and it looks like we've addressed the comments. We do have a handful, just where everyone knows there's lots of resources in the chat. So if you haven't taken a look to do so. Otherwise, it looks like we addressed all except for one. I see a question from Shared Touch from Carolyn asking about a memo number regarding EVV. And so just wanted to let you know, Carolyn, we are working on getting that for you. So hang tight. Otherwise, we're good, Kurt, to keep going.
If I could also jump in, Amanda mentioned that there are a lot of resources in the chat. Bobby usually pulls the content from the chat and sends it out to everybody. So if there are any resources that have not already been shared with the group that happen to live in the chat, Bobby does her due diligence to make sure that those are received to you also.
And just so people know, I do peek through the slide deck to make sure that nothing got missed in the slide deck that you guys should know.
Awesome. Thanks, Bobby.
Kurt, since you're here, I'm gonna take a breather and let you go for a while.
Sounds great. I got everything hooked up here technically. So my apologies, everyone. Got my brand new computer here for the holidays, and this is my first Zoom call since I've had it, and went, oh, everything's not paired up. So got things straightened out though, and we're ready to go. Hey, so where are we? We're ready for breakout rooms, I see. And so then we'll be splitting up into break rooms. What did we have? I think about 20 minutes we had designated for that here. It's about 2:20, 10. I'm sorry, 2:20. So feel free to join whatever breakout room is appropriate for you, and then we'll meet you back on the backside.
Thanks, Kurt. And you can also join the breakout rooms by clicking the 4 boxes in your menu named breakout rooms. And if you need help or you're calling in, you can stay in the main room and we can help you get into the room that you'd like to join.
Welcome back, everyone. All right. Everyone getting back here? So sorry, everyone. I had little technical issues. I had to get all my stuff disabled and paired up on my computer, and apparently it seems to be working now. So my apologies. How the breakout rooms go for everyone? Do we have anyone who wants to have their reports or anything to report at all? How about the INH group? Any questions or remarks you had to make?
Hey, Kurt, it's Amanda. I'll go ahead and do a quick little call out. So IHSS
Sure.
room, we really went over some of those resources we talked about previously in the meeting for the Medicaid sustainability website, as well as some options for mediation with CDCO and our case management escalations form. So shared a few resources in that group and just had some discussion about future care planning. So,
Oh, thanks, Amanda.
yeah.
All right. How about the group for the FMSs and vendors? Any follow-up you guys wanted to share?
Hey, Kurt, it's Jessica. I don't think we have anything to share. But Savannah, I don't know if you want to share your announcement to the larger group. If not, then no more comments from us.
Yeah, I would be happy to. This is Savannah from Palco. I have moved into the client engagement manager position over here at Palco. That does not mean I'm stepping out at all on the Colorado team. I'm still managing the Colorado team, but Chelsea, which you all have met at this point and probably became pretty comfortable with, she is going to be the primary client engagement specialist on this team. So she will be managing the CDAS box. And so my email will be just for escalation. So if you could reach out to Chelsea at the CDAS box for anything that you need, and then Chelsea will include me if there's anything that she needs support with.
Okay. Okay. I did see something in the chat. Was that was for, is that for Kathy Sanders, Jessica?
Yeah, I also remembered that there was another kind of announcement in our breakout room. So I want to make sure Kathy has the opportunity to share if she'd like to as well.
Yeah, I had just shared and introduced our new training lead, Marissa Newton. This is her first PDPPC meeting, so.
Welcome, Marissa. All right. The only thing, we did have one thing as well in ours. Basically, we've had members express concerns regarding agency turnover or case manager turnovers, especially with developmental pathways. I don't know if anyone from developmental pathways is on the call. She's just trying to, they have new assessments coming up, and a lot of this is regarding the HMA services and people just not understanding or getting back to her about that. Anyone from developmental pathways here by chance? So I think afterwards, Jessica, or who would be best to talk to about that? Would that be maybe you, Danny?
So sorry, Kurt. I think I missed what the question was.
Um, we've had a member very concerned that developmental pathways um, is not getting back to the member regarding health maintenance issues or
Oh.
upcoming evaluations coming up. So they've
I
had a few
would
issues in that Longmont area.
I would strongly encourage them to reach out to our case management escalations inbox. They manage all things escalations and can help make sure that communication is happening effectively with DP and they can work with you on the specific case. Amanda, I think you have the chat because you just gave it to somebody. So Amanda will put the chat, the link in the chat for the group. This is also on the HICPUF webpage if you type in case management grievances.
Okay, I'm going to copy that link and I know who to send that to as well. Then I have it in my email. And then I did hear some issues regarding the department or people being notified that they're no longer eligible for Medicaid again and being removed or stopped having CDOS benefits. I hadn't heard that happen in a few more years, but any word about people who to call? Should they call in the buy-in number? Is the 800 number or something still in effect? I know I had that. We had a lot of those issues when they switched from the bus system to a new computer a few years back, if I remember. I'm not sure who they contact if they're getting removed and they shouldn't be.
If they're getting removed from,
They're being told they're no longer eligible for Medicaid, and as a
I
result, their
would
benefits have stopped.
I would have them reach out to the same escalation box that Amanda just gave the link to. This escalations team manages all the different escalations and they triage the questions and get them to the people that can help the most.
I've heard the responses are the most quick for those, but I know that people have been filing for appeals, and I think if I remember, benefits need to continue during the appeal. Is that correct?
Yep, that is correct.
Okay.
Yeah. And unfortunately, I think at this point, the best I can give you is the escalations inbox. That's our resource right now for escalated issues.
Yeah. There used to be an 800 number, wasn't there, for buy-in program?
I am not entirely positive, Kurt.
Okay, I remember. I just remember I called 1 years ago and I'll look it up, see if I can find it yet. All right. Anyone else have anything else? And one last thing I just want to throw out there is final wrap up. This is our longer meeting. We had planned on until 3:05 at least. We're running a little bit ahead of schedule. So we do have one last open forum. Anyone can throw out information regarding any things they'd like to add or maybe have a short answer to, or better yet, ask if we would like to have that as an agenda item in the next upcoming meetings. And of course, if you do have an agenda item, you can go to the PDPPC portion of the website at the Department of Healthcare and add in requests for agenda topics there as well. But does anyone have any open forum items before we call it a day?
Andrea Rivera has her hand up.
Go for it.
Thank you. Yeah, my comment was just in regards to people losing their benefits. We have had really good success rate with the escalations form. However, we've been told that we should still be appealing because that's the only way to ensure that there's no loss of coverage. So you would do both, an escalation and an appeal.
Good. So I know the person who was on it is probably still on the call. Hopefully she's hearing that and understands that she does have some resources to go ahead and make things happen and be proactive. So great. Anyone else? I cannot see everyone else's hand raised today for whatever reason. got to redo my Zoom, I think, viewing screen here. Anyone else have anything? Or you can put something in the chat if you're in and want to be in the queue. I see a question here from Jerry. Who completes the level of care form? Is that just for the case manager to complete, something that the AR should be completing, or getting Medicaid information, medical information for it? So I don't know if Aaron or someone on that can answer that.
This is Danny with the department. The case manager completes the level of care. It's what's completed during the annual assessment. And the AR can support with providing HMA documentation, or they can support at the assessment, but the case manager is the one that completes the level of care form.
Great. And I see Jerry says thank you. And one thing I'll say is the case manager will ask the questions as an AR, as yourself. Don't be afraid to volunteer information if needed for that HMA. My experience is the better you know about yourself, the better you share, the better your benefit will be.
And
Right?
now Jessica has her hand up.
Okay, Jessica.
Thanks. Excuse me, everyone. I just wanted to share that we did get the 2026 meetings in the OCL, Office of Community Living Stakeholder Engagement calendar. I'll drop the link in the chat.
Okay.
And if I can find it. And so with this, y'all will be able to, excuse me, hold on. You'll all be able to add those meeting sessions as calendar invites on your personal calendars.
Okay.
It's still the same cadence. So every fourth Wednesday, starting at 1, the third Wednesday of the month for November and December, if we have a December meeting. And the first month of every quarter is our longer meeting.
Okay. All right. Well, sales stakeholder engagement. Thanks, Jessica. Just popped in. Anyone else have anything else? I'm just trying to look for hands up here. I managed to get my whole screen showing a little bit now. That's nice. All right. Good meeting, everyone. So if there's nothing else, if we can have someone want to call this meeting adjourned, we can get on and hopefully enjoy some wonderful Colorado weather these days. Take care, everyone.
Have a nice afternoon, and we'll see you next month, hopefully.
Bye now.
Thank you.
Thank you.
Bye. Thank you.